So what's so neat about this conversation, we really are talking about holistic type of a circumstance. So even in the instance of stress management, we're kicking out cortisol, we're getting hungry, creates a vicious cycle, work-life balance. Diabetes is a symptom of modern life, maybe more so than anything. And so we have this sort of in the community, you're discharging patients or working with patients 10, 15, 20, 30 miles away at the VA. Do you make an assessment of resources available? Is the local YMCA doing something with diabetes prevention? Do you have access to a wellness center? I mean, how are you sort of coaching them into this care team, extended care team?
Darren and I are kind of in that perfect world because the VA does readily work with team partners. We do have our whole health team that is going out. We have patients that will then have classes at the YMCA. So it is really a good system for our veterans. Now, whether or not I see that happening with my own family members and their primary care services, I have not seen that level be brought up at this point.
I always say we practice in a bubble, and despite some of the stuff that you might see out there, like the care that our veterans are getting is next to none. I mean, you're never gonna see, I'm a CDE, but there are on days which I have a 15-minute slot or a 30-minute slot. I can't do the nutrition piece, but I can make sure that I can walk that person down to the nutritionist, and there's someone that's available to see that same patient that same day. So it's not another appointment, and it's just a carve-out slot, or there's someone just ready to kind of do a warm handoff. And so we're kind of very fortunate to have those resources.
So let's pretend that you're filling out a budget for this next year, and you want to have all of your staff be certified diabetes educators. Susan, make the best case you can that that's a worthwhile endeavor to the CFO.
Well, I'm fortunate that I don't have to worry about that because I'm definitely siloed away from that. Working in a free clinic, we work by donations for the most part, but in a former life,
to your donors.
Yes, and in a former life, I actually was able to plead this case. One of the biggest things is from being a CDE provides you with the tools needed once again to educate the patient, because just because a patient is told to do something doesn't mean they're going to do it. So we work with the patient to develop a care plan that fits their needs. There's the frequent follow-through, or should be, and obviously, reimbursement for these services is available through third-party payers. What is that reimbursement? That probably could be improved a little bit, but that's pretty well across the board. I believe as we go more into value-based care, and we're starting to look at what are we meeting? Are we meeting our metrics? This is where a CDE will be very important, because it will take some of the burden off the prescriber to do that education. So again, it goes back to the team-based care. If we have everybody on the team, the educator is there to provide that education in a format the patient can understand. Most providers don't have that amount of time. They don't have the time to do that.
So Jess, who should be a CDE in the system? Everybody, some of us?
What I was going to chime in and say is if it was me, I would make the case against it. If I was that CFO, I would not. And this is coming from someone that is a CDE. I don't think we need, if we had everyone that was a CDE, I think what you said, the pain points, the tools and resources. But if I had an X amount of money, I would not spend my pool having everyone go through a credentialing exam. There's just a lot of better use of resources that could happen. I mean, you could bring in Sue and teach all of the pharmacists that are there. It's a
So
transferable
who's
skill
ideal?
set.
Ideal then would be all the pharmacists, some of the pharmacists,
I think
pharmacists
some.
in your clinic,
Some,
pharmacists
yeah.
in the community.
And
You said a word that I love, which is care planning, or a term I love,
Yeah.
which is care planning.
Yeah.
Is it the folks that are most likely to be involved in the
That's
care
it. Yeah.
planning, and
Yeah.
really we're talking about meds?
The same
pretty
way we
intensively
teach
here,
students
so.
and residents and fellows, and they all don't walk away from our rotations being certified diabetes educators, but they have the skill set that's needed. Now, what I can't talk to is the reimbursement piece, and if that ROI makes sense to do it, again, because we're not in that billing capacity. But I would say that there's a lot of resources, especially anything that you can do to take the care outside of that 6 to 7 times that you might see a patient. There's a ton that's happening outside of the clinic doors, where if some of those resources then go outside to telehealth and being able to engage a patient outside, I think would be of more benefit, more value.
So if you've got a 50-mile radius of patients, if there were 100 pharmacies out there and 30 of them had a CDE would you be more likely to refer them to those pharmacies that have the CDE?
Sure, because I know that there's someone that has gone through that training, knows that that person is there, that I could send someone to, not knowing a relationship, not knowing someone there.
And they're more likely to know how to use the products,
Yeah.
they're more likely to be well versed in it, stay
Yeah.
up to date.
But I think it comes down to your own personal and professional development, where we have so many nationwide in a network of pharmacy coaches or pharmacist coaches that essentially and maybe doing the exact same job of a CDE or a BCADM without that credential behind them. So it's really the passion that comes into wanting to serve that population.
And the referral.
And the referral, yeah. Now, from an outside standpoint, yes, I think that CDE does give more weight to those referring providers. And so I could see the need to at least have one team have at least one CDE involved if you're wanting to increase referrals. But whether or not, entry-level pharmacists can or cannot do the job, that's not the question. They're baseline trained like that in their PharmD
And how many,
curriculum.
you travel a lot and you've talked to a lot of independent pharmacies. I mean, there's some great pharmacists that are doing, diabetes care, and they might not have a CDE credential, but I think that point that you bring up is if you're trying to go to that endocrinology practice and saying, send your patients to me, I think that helps in those discussions, but there's plenty of them that have done it without that.
And I think it's important to realize too, the CDE or even the BCADM is not specific to pharmacists. Nurses, dietitians, physicians, dentists, physical therapists, so other people can actually, other disciplines can get this. So that's one of the nice things about it is kind of a multidiscipline credential, and it has, again, the baseline of what is needed to meet this credential, but it can be held by various disciplines.
So it sounds to me like
pharmacists are a minority.
We are.
So it sounds to me like, though, what you're saying is, here's your medications, your plan of care, but part of that prescribing is, hey, I want you to meet with a diabetes educator or equivalent, and that becomes part of the prescribing, except it's prescribing a service or a coach.
Yeah. At the end of the day, it's that frequency of touch points. It could be a health
So is that a
coach.
best practice for you, though? So for all of your patients, you endeavor to make sure, obviously you're a CDE, so you're doing that, but to make sure that the patient has access to that education is part of your planning and discharge process.
Because a lot of my interactions are once you have that initial visit, I don't know if I necessarily need to see them face-to-face for every single visit. There are certain things that if I can get those pieces of information, I might be able to save them some gas money and save them that trip. Where we'll all right, it's not ideal, but it's 60 miles each way. You got to kind of meet the patient where they're at.
Sure. And every clinic has no-show rates.